If you don't have enough fat or you don't want to go anesthesia, Alloclae might be the option for you. All right, guys, I'm here to talk about a new product that is coming into the plastic surgery aesthetic market, and that is called Alloclae. And so what it is basically really the holy grail of body contouring soft tissue filler. Super exciting. We've heard this has been coming for a while. The way they make it is basically they take donors who donate fat cells, and the fat cells and the extracellular matrix, which is called ECM. This is processed with things to decrease the immunogenicity of the product for our bodies to react to the product. And so now we just have a really great structure of the soft tissue. And that's really what this is really important, is that we have the structure of the fat cells. So we're basically replacing like with like. So this can be done in the office on a local anesthesia. You know, sometimes we can use it for surgery and if we're doing other procedures as well. But this is really just basically fat transfer in an office setting under local. I would say the number one indication for me most likely is contouring of the buttock. And so I do a lot of patients who want like that skinny BBL. They don't have any fat for fat transfer, or we've done implants before and then I've done everything I can to get as much fat over from them to do fat transfer around the implant, kind of camouflage it. And I've had many patients who they don't have anything else to give me. And really, there's really no other options. Hyaluronic acids is, you know, we're talking about little cc's does nothing in the large surface area of gluteal aesthetics. You know, you have Sculptra, and I've seen women like waste tens of thousands and thousands of dollars on that product, and it does hardly anything. So don't make that mistake. Where are we going to use it? We're going to use this product most likely in areas of the hip dips. We're going to use it in areas of like contour irregularities, like if you've done liposuction before, you have like a little lump. We can kind of fill that in. Now we can have fat, and that makes a really great indication for that. I think I'm using a lot in breasts. And so for breasts, for women have really, really thin breast tissue, and they have like maybe some rippling or something they don't like because your skin is just so thin. You know, typically we're going to use some kind of fat transfer. We take fat from some part of the body, put it into the breast, and it kind of soften the visibility of the rippling. But now we have something that can be done in the office, which is super, super, super powerful when you don't have to go under full anesthesia. Super excited to be bringing this in my practice. We're going to be doing, I will predict a lot of it. It's going to be done here in my office. If you're interested, all those patients I've done skinny BBLs or implants, you know, we've talked about this before. We finally got it, and I look forward to seeing you.